Dementia is one of the most pressing public health concerns of the 21st century, touching the lives of millions of individuals and families across the globe. It's not a single disease, but rather a broad term that covers a range of medical conditions, all of which are, characterized by a progressive decline in mental ability. That's severe enough to interfere with daily life. Most people tend to associate dementia with memory loss, but honestly, it goes far beyond that, affecting language skills, problem-solving abilities, attention span, visual perception, and even a person's personality and behavior. As the global population ages, understanding dementia, what it is, how it presents, and how it progresses, becomes ever more critical. Not only for healthcare systems, but really for society as a whole. The human brain is an intricate network of neurons and connections responsible for every thought, emotion, and action we experience. Dementia arises when this delicate network begins to break down due to disease or injury. The result is a loss of function in various parts of the brain, depending on the specific type of dementia and the regions affected. While memory impairment is often one of the first signs, especially in Alzheimer's disease, other forms of dementia may present initially with different symptoms, such as language difficulties, changes in mood or personality, or even visual hallucinations. This wide range of potential symptoms makes dementia a complex condition to diagnose and manage, especially in its early stages. The causes of dementia are equally diverse. Neurodegenerative diseases, which involve the gradual death of brain cells, are among the most common. These include Alzheimer's disease, Lewy body dementia, frontotemporal dementia, and Parkinson's disease dementia. Each of these conditions follows a unique progression pattern and affects different areas of the brain. In contrast, vascular dementia is caused by impaired blood flow to the brain, often resulting from strokes or small vessel disease. Some forms of dementia are due to infections such as Creutzfeldt-Jakob disease, while others can be the result of long-term alcohol abuse, trauma, or even autoimmune responses. In rare cases, dementia can stem from reversible conditions like vitamin deficiencies or hormone imbalances, which, when treated, can lead to significant cognitive improvement. Despite these differences in origin, all dementias share one common thread. They involve damage to brain cells that disrupts their ability to communicate with each other. This cellular miscommunication impairs the brain's ability to function normally, leading to the progressive symptoms associated with the condition. One of the challenges in diagnosing dementia is that early signs are often subtle and can be mistaken for normal aging. People might notice occasional forgetfulness, difficulty concentrating, or, a tendency to misplace items. These early symptoms are often dismissed or overlooked until they begin to interfere with daily routines and responsibilities. Understanding the difference between normal cognitive aging and dementia is crucial. As people grow older, it is natural to experience some decline in memory and cognitive speed. Forgetting a name or occasionally misplacing keys does not necessarily indicate dementia. However, when these memory lapses become frequent and individuals begin to have trouble managing finances, following a recipe, or remembering important dates or events, it may be time to seek medical advice. Another key indicator is a noticeable decline in judgment and reasoning abilities, leading to poor decision-making or increased vulnerability to scams and misinformation. Diagnosis of dementia involves a thorough evaluation, often including a detailed medical history, cognitive testing, neurological examinations, brain imaging, and blood tests. Cognitive assessments, such as the Mini Mental State Examination or the Montreal Cognitive Assessment, help determine the extent and pattern of cognitive impairment. Imaging techniques like MRI or CT scans can reveal structural abnormalities in the brain, such as atrophy, strokes, or tumors. Blood tests are used to exclude other potential causes, such as thyroid problems, infections, or vitamin deficiencies. In many cases, diagnosis is a collaborative process that includes input from neurologists, geriatricians, psychiatrists, and neuropsychologists. There is also an emotional and psychological dimension to dementia that cannot be overlooked. For the individual affected, the journey into dementia can be disorienting and honestly, pretty frightening. As they struggle with memory lapses, confusion, and the loss of independence, feelings of frustration, sadness, and anxiety often arise. For caregivers and loved ones, Witnessing the gradual decline of a person they once knew intimately can be emotionally devastating. The burden of care, especially in advanced stages of the disease, is considerable and often leads to caregiver burnout. Support systems, both formal and informal, play a vital role in managing the emotional toll of dementia for everyone involved. Dementia generally progresses through a series of stages, from mild cognitive impairment to advanced late-stage dementia. In the early stages, symptoms may be mild and barely noticeable. Individuals may forget recent conversations, lose track of time, or struggle to find the right words. As the disease progresses into the middle stage, memory loss becomes more severe, confusion increases, and individuals may begin to withdraw socially or become suspicious of those around them. Behavioral changes such as agitation, aggression, or depression may also emerge. In the final stages of dementia, individuals typically lose the ability to communicate effectively, require assistance with basic activities like eating and dressing, and may become bedridden or unresponsive. While there is currently no cure for most types of dementia, early diagnosis can make a significant difference in quality of life. It allows for better planning, access to support services, and in some cases, treatments that can slow the progression of symptoms. Medications such as cholinesterase inhibitors and memantine can offer modest improvements in cognition and function for some individuals, particularly those with Alzheimer's disease. Non-drug approaches, including cognitive stimulation, physical activity, and behavioral therapies, also play an essential role in maintaining function and emotional well-being. Reversible dementias, though less common, offer hope in situations where the underlying cause can be identified and treated. Conditions such as vitamin B12 deficiency, hypothyroidism, chronic infections, or side effects from medications can mimic dementia symptoms. In such cases, appropriate treatment can lead to full or partial cognitive recovery. This really underscores the importance of a comprehensive diagnostic process that explores all possible causes before confirming a diagnosis of irreversible dementia. The prevalence of dementia is staggering and expected to rise sharply in the coming decades. According to estimates from the World Health Organization, over 55 million people currently live with dementia worldwide, and nearly 10 million new cases are diagnosed each year. It is the seventh leading cause of death globally, and a leading contributor to disability and dependency among older adults. The economic impact is equally profound, with billions spent annually on healthcare costs, social services, and informal caregiving. This growing crisis calls for coordinated efforts in research, public awareness, and caregiver support. Despite its challenges, living with dementia does not have to mean the end of a meaningful life. Many individuals in the early and middle stages of dementia continue to enjoy relationships, hobbies, and personal accomplishments. With proper support, environmental adaptations, and a compassionate approach to care, people with dementia can maintain a sense of identity and dignity. Education and understanding are key, not only for those diagnosed, but for the broader public. Reducing stigma, promoting empathy, and encouraging early intervention can go a long way in improving outcomes and enhancing the lives of everyone affected by dementia.
Lewy body dementia, often called LBD, is a progressive brain disorder, and honestly, one of the most complex and challenging forms of dementia. It affects an estimated 1.4 million individuals in the United States alone. It's characterized by the presence of these abnormal protein deposits in the brain called Lewy bodies, which are actually named after the German neurologist Friedrich H. Lewy, who first discovered them. These abnormal clumps of alpha-synuclein protein disrupt normal brain functioning, especially in areas involved in thinking, movement, behavior, and mood. LBD actually encompasses two related diagnoses: dementia with Lewy bodies and Parkinson's disease dementia. The distinction between these two lies mainly in the timing of symptom onset. So when cognitive decline comes before or closely follows movement symptoms, we call it dementia with Lewy bodies. But if cognitive symptoms appear a year or more after the onset of motor problems, that typically falls under Parkinson's disease dementia. One of the hallmark features of Lewy body dementia is, honestly, these pronounced fluctuations in cognitive function. Individuals can have good days where they communicate clearly and function pretty well, and then, suddenly, there are days of profound confusion, disorganized thinking, and inattentiveness. These fluctuations can actually happen really quickly, even within the same day, which makes the disease particularly unpredictable and, frankly, difficult for caregivers to manage. This kind of fluctuation really sets LBD apart from Alzheimer's disease, where cognitive decline is usually more stable and consistently progressive over time. Visual hallucinations are another distinctive and early symptom of Lewy body dementia. These hallucinations are often vivid and detailed, involving people, animals, or objects that just aren't there. Unlike hallucinations from some psychiatric conditions, those associated with LBD are often recognized by the individual as not real, at least in the early stages. But over time, these hallucinations can become more frequent and convincing, which can contribute to distress and sometimes lead to delusions. For example, a person might believe someone is living in their home or that loved ones are conspiring against them, which can lead to paranoia and anxiety. Movement symptoms in LBD are honestly very similar to those seen in Parkinson's disease. These include tremors, muscle rigidity, slow movement, what we call bradykinesia, shuffling gait, and a stooped posture. These physical symptoms can increase the risk of falls and injury, and they may appear either before or after cognitive symptoms. Muscle stiffness and difficulty initiating movement can make daily tasks, like dressing, eating, and walking, much more challenging, often requiring increased support from caregivers and the use of assistive devices. Sleep disturbances are also a pretty prominent feature of Lewy body dementia, especially REM sleep behavior disorder. This condition causes individuals to physically act out their dreams, which can mean kicking, punching, or even yelling during sleep. These behaviors can disrupt sleep for both the individual and their bed partner, and sometimes they even result in injuries. In many cases, REM sleep behavior disorder actually comes years before the onset of cognitive and movement symptoms, serving as an early warning sign for the development of LBD or related disorders. Individuals with Lewy body dementia may also experience significant changes in autonomic body functions, which are regulated by the brain and nervous system. These include fluctuations in blood pressure, digestive problems, urinary incontinence, excessive sweating, and difficulty regulating body temperature. These symptoms, though not always immediately linked to dementia, can contribute significantly to discomfort and a reduced quality of life. Their presence also underscores the systemic nature of LBD, which affects not just cognition and movement, but also many basic bodily functions. Another challenging aspect of LBD is the sensitivity many individuals have to certain medications, particularly antipsychotics. While antipsychotic medications are sometimes prescribed to manage hallucinations or behavioral disturbances in other forms of dementia, people with LBD often react negatively to these drugs. These reactions can include increased confusion, severe muscle rigidity, or even life-threatening conditions such as neuroleptic malignant syndrome. For this reason, careful consideration and close monitoring are essential when introducing any new medication, and non-drug approaches to behavioral symptoms are preferred whenever possible. Diagnosing Lewy body dementia can be particularly difficult because its symptoms overlap significantly with those of both Alzheimer's and Parkinson's disease. In many cases, individuals are misdiagnosed, leading to inappropriate treatment and increased risk of harm. A detailed clinical history and neurological examination are key to distinguishing LBD from other dementias. Imaging studies such as MRI or PET scans may show reduced dopamine activity in certain areas of the brain, helping support the diagnosis. Cognitive testing often reveals impairments in attention, visual spatial skills, and executive function, with memory remaining relatively intact in the early stages. The course of Lewy body dementia varies from person to person, but generally involves a progressive decline in cognitive and physical abilities. While some individuals live for many years with relatively mild symptoms, others may experience rapid deterioration. As the disease progresses, individuals may become increasingly dependent on others for daily activities, including bathing, dressing, eating, and mobility. Communication can become more difficult, especially during periods of confusion or hallucination. At advanced stages, swallowing difficulties and severe motor impairment may lead to increased risk of aspiration, pneumonia, and other complications.
Parkinson's disease. Dementia is a type of dementia that develops in the context of an established diagnosis of Parkinson's disease, a progressive neurological condition that primarily affects movement. Parkinson's disease itself is caused by the loss of dopamine-producing cells in a part of the brain called the substantia nigra, which leads to the classic motor symptoms of tremors, stiffness, bradykinesia, meaning slowness of movement, and postural instability. However, in many cases, Parkinson's disease eventually progresses beyond movement-related issues and begins to affect cognitive functions, culminating in Parkinson's disease dementia. It's estimated that up to 50 to 80% of people with Parkinson's will develop dementia as the disease advances. One of the defining characteristics of Parkinson's disease dementia is that it occurs only after a person has had Parkinson's disease for a year or more. If cognitive symptoms appear at the same time as, or within a year of, motor symptoms, the diagnosis may instead be Lewy body dementia, which is a closely related condition. The distinction is subtle, but clinically important because it can influence treatment strategies and prognosis. In both cases, abnormal protein deposits called Lewy bodies are found in the brain, disrupting normal cellular function. These proteins, specifically alpha-synuclein, are toxic to neurons and accumulate in regions responsible for memory, behavior, and movement. The symptoms of Parkinson's disease dementia often begin subtly and progress gradually. One of the early signs may be impaired executive function, the ability to plan, organize, and multitask. Individuals may have difficulty with complex tasks, such as managing finances, following instructions, or adapting to changes in routine. Slowness in thinking, also known as bradyphrenia, is another common early symptom, leading to delayed responses in conversation or problem solving. Attention and concentration may waver, and individuals may find it hard to stay focused or process information quickly. As the condition advances, memory impairment becomes more noticeable. Unlike the early stages of Alzheimer's disease, where short-term memory loss is predominant, memory issues in Parkinson's disease dementia are often related to difficulties with retrieval rather than storage. That means the person may know the information, but struggle to access it on demand. Visual spatial difficulties may also arise, making it harder to navigate familiar environments, judge distances, or perform tasks that require coordination between the eyes and hands. Another hallmark symptom is visual hallucinations, which are common and often distressing. These hallucinations typically involve seeing people, animals, or objects that aren't there. Unlike hallucinations in some other forms of dementia, those in Parkinson's disease dementia may be well-formed and persistent. People may also experience delusions, false beliefs that are firmly held despite evidence to the contrary. For example, a person might believe their spouse is an imposter, or that someone is stealing from them. These psychiatric symptoms can significantly affect quality of life and often require careful management. Mood disturbances are also frequent in Parkinson's disease dementia. Depression, anxiety, and apathy are particularly common and may exacerbate cognitive symptoms. Apathy, or a lack of motivation and initiative, can be mistaken for depression, but is a separate issue that profoundly affects daily functioning and engagement. People may withdraw from activities, become socially isolated, or lose interest in hobbies and relationships, which in turn can contribute to caregiver stress and feelings of helplessness. Motor symptoms continue to play a prominent role in Parkinson's disease dementia. Tremors, stiffness, and balance problems persist and may even worsen as cognitive functions decline. This dual burden of physical and mental impairment makes Parkinson's disease dementia especially challenging for both patients and caregivers. The risk of falls increases and the ability to perform daily activities independently diminishes, often necessitating the use of mobility aids, assistive devices, and home modifications to ensure safety. Diagnosing Parkinson's disease dementia, involves a careful clinical evaluation, since there really isn't a single test that can definitively confirm the condition. Neurologists typically assess the timing and progression of symptoms, looking for evidence of cognitive decline that develops after a diagnosis of Parkinson's. Neuropsychological testing can help pinpoint areas of cognitive weakness and distinguish between different types of dementia. Sometimes brain imaging is used to rule out other causes of cognitive decline, like strokes or tumors, but it's important to note that it isn't definitive for Parkinson's disease dementia. Treatment for Parkinson's disease dementia is, well, multifaceted and aims to address both cognitive and motor symptoms. Cholinesterase inhibitors, such as rivastigmine, are often prescribed to enhance cognitive function and have shown modest benefit in slowing the progression of symptoms. These medications work by increasing levels of acetylcholine, which is a neurotransmitter involved in memory and learning. However, their effectiveness can vary quite a bit, and they may cause side effects like nausea or dizziness. Managing motor symptoms in the context of dementia can be, honestly, pretty tricky. Medications used to control Parkinson's motor symptoms, like levodopa, may sometimes worsen hallucinations or confusion, so it becomes a delicate balancing act in treatment. Because of this, adjustments to dosage and timing may be necessary, and medications should be carefully monitored to avoid exacerbating cognitive issues. In some cases, antipsychotic medications might be used to manage hallucinations or delusions. But these really must be chosen with caution, since many antipsychotics can worsen motor symptoms or cause severe side effects in individuals with Lewy body pathology. Non-pharmacological interventions are a crucial component of care for Parkinson's disease dementia. Physical therapy can help maintain mobility, flexibility, and balance, while occupational therapy can support the performance of daily tasks and enhance safety at home. Speech-language therapy is also important, particularly for addressing swallowing difficulties and communication challenges. Cognitive stimulation activities, such as puzzles, music therapy, and reminiscence therapy, may offer emotional and cognitive benefits, especially when tailored to the individual's interests and capabilities. Caregiver support is an essential aspect of managing Parkinson's disease dementia. The progressive nature of the condition places increasing demands on caregivers, who must deal with a complex combination of motor, cognitive, and psychiatric symptoms. Education about the disease process, practical caregiving strategies, and emotional support can help caregivers cope with stress, prevent burnout, and maintain their own well-being. Support groups and respite services provide vital resources for families navigating the journey of Parkinson's disease dementia. Planning for the future is equally important. As the disease progresses, decision-making capacity may decline, and individuals may lose the ability to express their preferences regarding medical care, finances, and living arrangements. Early discussions about legal and financial matters, including powers of attorney and advance directives, can ensure that the person's wishes are respected and that caregivers are equipped to make informed decisions on their behalf. While there is currently no cure for Parkinson's disease dementia, ongoing research offers hope for better treatments and earlier detection. Scientists are investigating the role of alpha-synuclein in brain degeneration and exploring new therapies aimed at slowing or halting its accumulation. Advances in biomarkers, imaging techniques, and genetic studies are paving the way for more precise diagnosis and targeted interventions, with the goal of improving outcomes for individuals affected by this condition. In conclusion, Parkinson's disease dementia is a challenging and multifaceted condition that arises in the later stages of Parkinson's disease, combining the physical impairments of a movement disorder with the cognitive and psychiatric symptoms of dementia. It is marked by difficulties with attention, memory, executive function, hallucinations, and emotional regulation. Managing the condition requires a holistic approach that addresses both cognitive and motor symptoms, supports caregivers, and plans for long-term care. Though the journey can be difficult, comprehensive care and support can make a meaningful difference in preserving dignity, comfort, and quality of life for those affected by Parkinson's disease dementia. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends and family, and most importantly, subscribe to the channel for more simple health tips that make a big difference. And while you're at it, tap the notification bell so you never miss out on our latest content. Thanks for watching, and we'll see you in the next video. Stay healthy and keep smiling.